Hello everyone, and welcome back to the channel. Today, we're discussing a developing public health situation in Ethiopia that warrants our attention. Health authorities there are currently investigating a cluster of suspected viral hemorrhagic fever cases in the country's South Ethiopia region. This is a serious situation, and a swift, coordinated response is crucial. So, what exactly is happening on the ground? As of the latest reports, there are 8 suspected cases. It's important to stress the word suspected right now. Samples have been sent to the Ethiopia Public Health Institute for laboratory testing to identify the exact virus causing these illnesses. This step is critical because viral hemorrhagic fever isn't a single disease. It's a category of illnesses that includes some very well-known and dangerous viruses like Ebola, Marburg, Lassa fever, and Crimean Congo hemorrhagic fever. While they all share some initial symptoms like high fever, extreme fatigue, dizziness, and muscle aches, each one is caused by a different virus and can have its own specific characteristics and transmission methods. That's why confirming the exact pathogen is the #1 priority for the health teams right now. This will guide every aspect of the response, from treatment protocols to public health messaging. The rule of thumb in public health is to report any suspected case or cluster immediately, even before the specific virus is identified, to get a head start on containment. In response to this alert, the World Health Organization, or WHO, is stepping in to support Ethiopia's national authorities. This is a fantastic example of global health collaboration in action. The WHO is not just sending funds, they are deploying a rapid response team. This isn't just one or two people. It's a multidisciplinary team of 11 technical experts. These are seasoned professionals with direct experience in handling outbreaks of this nature. Their expertise covers a wide range of essential areas. We're talking about specialists in disease surveillance, who will help track the spread of the illness. There are experts in case investigation, who will work to understand how and where these individuals were infected. Laboratory testing support will help expedite the confirmation process. Then you have specialists in infection prevention and control, or IPC, which is absolutely vital to protect healthcare workers and prevent the disease from spreading. Within hospitals and clinics, clinical care experts will advise on the best way to treat patients, and community engagement specialists will work to ensure the public has accurate information and knows how to protect themselves. Finally, outbreak response coordinators will help manage the entire operation, ensuring all these different parts work together seamlessly. This comprehensive approach is key. An outbreak isn't just a medical problem, it's a logistical, social, and communication challenge all at once. Having experts on the ground who can address all these facets simultaneously is the best way to get a handle on the situation quickly and effectively. Beyond personnel, the WHO is also providing critical supplies. This includes personal protective equipment, or PPE, for the frontline health workers. We all remember how vital masks, gowns, and gloves were during past outbreaks. Ensuring that doctors and nurses are protected is non-negotiable. They are the most valuable resource in any health crisis. The WHO is also sending a rapidly deployable isolation tent. This is essentially a mobile field hospital unit designed to safely isolate and treat patients, which helps to increase the capacity of local health facilities and prevent further transmission. To get this response up and running immediately, the WHO has released $300,000 from its contingency fund for emergencies. This fund is specifically designed for situations like this, providing quick, flexible cash to kickstart operations on the ground without waiting for longer-term funding to be arranged. It allows the teams to buy necessary supplies locally, cover transportation costs, and and address any immediate needs that arise. It's the financial fuel that gets the engine of the emergency response started right away. Additional technical capacity is also being mobilized, meaning more experts and resources are on standby, ready to be deployed if the situation escalates. Now, let's take a step back and talk about viral hemorrhagic fevers in general. As I mentioned, it's a group of diseases. They are often found in specific geographic regions and are typically transmitted to humans from animals like rodents or bats, or through insect bites like ticks. Once a person is infected, human-to-human transmission can occur through direct contact with the blood, secretions, organs, or other bodily fluids of infected people, and with surfaces and materials like bedding contaminated with these fluids. This is why infection prevention and control measures are so paramount. Simple but rigorous practices like hand hygiene, proper use of PPE, safe handling of lab samples, and safe burial practices are the cornerstones of stopping an outbreak of a viral hemorrhagic fever. The initial symptoms are often nonspecific, which can make early diagnosis tricky. A person might just feel like they have a severe case of the flu with fever, exhaustion, and body aches. However, in severe cases, these diseases can progress to cause bleeding or hemorrhaging, which is where they get their name. This can manifest as bleeding from the gums, in the stool, or under the skin. It can also lead to shock, multi-organ failure, and unfortunately, can have a high fatality rate. It's a scary prospect, but it's important to remember that with rapid detection, good clinical care, and strong public health measures, outbreaks can be contained. The key is acting fast and decisively, which is exactly what we're seeing from the Ethiopian health authorities and their international partners like the WHO. So what happens now? The main focus is on the laboratory results. Once the specific virus is identified, the response will become even more targeted. For example, the treatment and containment strategies for Marburg are different from those for Lassa fever. The investigation teams will continue their work, trying to trace the contacts of the suspected cases to see if anyone else has been exposed. This contact tracing is a painstaking but essential process to break the chains of transmission. At the same time, community engagement teams will be working to dispel rumors and provide clear, actionable advice to the local population. In any outbreak, fear and misinformation can spread faster than the virus itself. Having trusted voices on the ground, providing accurate information in local languages, is just as important as having doctors in the clinics. We will be keeping a close eye on this developing story and will bring you updates as more information becomes available from the Ethiopian Public Health Institute and the WHO. This situation serves as a powerful reminder of the importance of strong public health surveillance systems and the incredible value of international cooperation in the face of health threats. Our thoughts are with the patients, their families, and the dedicated health workers on the front lines in Ethiopia. Thank you so much for watching. If you found this information helpful, please give this video a thumbs up and consider subscribing to the channel for more updates on global health issues. Stay safe, and we'll see you in the next video.